Welcome to today's training course. This course is designed to help you understand the Advanced Medical Life Support Patient Assessment Pathway for rapid diagnosis and decision making. After completing this course, you will be able to 1. Identify the components of the Rapid Patient Assessment Pathway. 2. Utilize the sick, not sick system of rapid patient assessment. 3. Identify the components of the initial impression of the patient. 4. Understand the importance of the initial impression of the patient. 5. Develop a rapid and systematic way to develop a differential diagnosis. And 6. Categorize critical, emergent and non-emergent conditions according to body systems. The key to a successful interaction with a patient in need is to have a predefined course of action that can be replicated by everyone involved. Recognizing potential hazards in your environment is your first step. Whether it's extreme weather conditions or at the scene of an accident, your safety and that of your team is of paramount importance. In hospital environments, this is usually not a priority. But in the application of care during a mass gathering, you may be called upon to operate in an environment that you may not be familiar with. In assessing any situation, it's crucial to stay alert while working outside the hospital. The continuous evaluation of the circumstances and remaining conscious of potential hazards to yourself, your team, the patient, and anyone nearby will save lives. At the heart of patient care, standard precautions and personal protective equipment are non-negotiable. Maintaining awareness with each patient encounter is crucial to prevent the spread of infectious diseases. Protecting both healthcare providers and patients is of paramount importance. The AMLS pathway stands as a trustworthy method for lowering the chances of severe health issues and death by identifying a wide variety of medical emergencies early on and handling them properly. The initial phase of the AMLS pathway involves ensuring the scene is safe, picking up on situational hints, identifying the cardinal presentation, understanding the chief complaint, and conducting a primary assessment. Once any immediate threats to life are dealt with, the next step involves forming an initial impression. You will form the first impression of your patient based upon the cardinal presentation and chief complaint. Visual clues, olfactory and kinesthetic observations at the scene will add valuable information to your patient's assessment process. The initial impression phase includes life-threatening conditions, a sick-not sick determination, and the formulation of an initial differential diagnosis. The primary survey is a critical phase, identifying life-threatening conditions and setting the stage for immediate management strategies based on the patient's emergent needs. To determine the patient's status, providers should follow this systematic approach. 1. Identify immediate threats to safety. 2. Control obvious signs on external bleeding. 3. Identify any compromise to the airway, breathing, or circulation. 4. If a life-threatening condition is identified, immediate interventions should be performed, and the remaining history can be taken later. If no life-threatening conditions are present, continue with the development of your differential process. Cardinal presentations are conditions and complaints recognized by the medical providers as key concerns. Usually these will be based on the chief complaint and reflect your recognition of what is the most critical condition to be evaluated. Understanding the patient's chief complaint guides our focus. It's about filtering through the noise to identify what needs our attention, steering our decision-making. A rapid assessment of the patient's consciousness, using tools like AVPU and the Glasgow Coma Score, provides insights into their neurological and perfusion status, critical for early management. The AVPU mnemonic refers to 1. Alert. 2. Responsive to verbal stimuli. 3. Responsive to painful stimuli. 4. Unresponsive. Level of consciousness is associated with the reticular activating system and the cerebral hemispheres responsible for the maintenance of consciousness, specifically the person's level of arousal. Assessment of the patient's level of consciousness helps determine whether the patient's neurologic and perfusion status is stable and allows life-threatening conditions to be quickly identified. Airway patency is a top priority. Ensuring the airway is clear and considering emergency interventions if necessary sets the foundation for effective patient care. Secretions, objects, and other foreign bodies should be immediately cleared. Now we assess breathing. Identifying any life-threatening conditions that compromise the patient's ability to breathe is crucial for timely intervention. When the airway is clear, evaluate the breathing status and lung sounds of the patient. The question here is, what is the rate, rhythm, and depth of the patient breathing? Are there abnormal sounds present? Conditions and injuries causing life-threatening compromise of the patient's ability to breathe may include 1. Bilateral pneumothorax, 2. Tension pneumothorax, 3. Flail Schetz, 4. Cardiac tamponade, 5. Pulmonary embolus. Remember that when a patient's chief complaint is respiratory distress, consider other possibilities such as hyperventilation due to respiratory alkalosis, hyperventilation due to metabolic acidosis, CNS insult, and stroke. Tachypnea, increased respiratory rate, is one of the body's coping mechanisms. Causes may include fever, respiratory distress, toxins, hypoperfusion, or anxiety. Bradypnea, slower than normal respiratory rate, may require both oxygen and ventilatory support. Causes may include narcotic overdose or oversedation, metabolic disorders, fatigue, or brain injury. Listening to lung sounds is a key component of the assessment. Lung sounds should always include the identification of the following if present. 1. Gurgling. 2. Stridor. 3. Wheezing. 4. Rales. 5. Rhonchi. An assessment of circulation now follows. Understanding the pulse rate and quality helps you gauge perfusion to major organs, informing our immediate actions to restore or improve circulation. The question to be asking at this point is, what is the rate, quality, and rhythm of the pulse? Is the pulse fast or slow? Is the pulse strong, weak, or absent? Is it regular or irregular? Are the pulses present in the central and peripheral circulation? If the patient has inadequate circulation, you must take immediate action to restore or improve it, control severe bleeding, and improve oxygenation. Calculate a quick pulse pressure by subtracting diastolic pressure from systolic pressure. The normal range is 30 to 40 mm Hg. If pulse pressure is low, less than 25% of systolic, the cause may be low stroke volume or increased peripheral pressure. Do not forget to check skin color, texture, and temperature. Capillary refill will also be a good indication of perfusion status along with pulse ox readings. You can now make your initial decision about the patient, sick or not sick. Sick warrants immediate, life-saving interventions or action. Not sick allows you then to move on to a more thorough investigation of the presentation. With life-threatening conditions addressed, the first steps of the AMLS pathway are complete. You will now form your first impression based on the initial presentation and chief complaint. Your visual assessment of the patient can reveal unspoken clues. What is the patient's body position? Are there any expressions of pain? Is the patient presenting decorticate or decerebrate, sitting tripod or fetal? All of these, of course, are signs of a more serious problem. The sense of touch also gives clues to the patient's current condition. Skin can feel cool, cold, warm, hot, or sweaty. Excessively warm or hot skin may indicate an elevated core temperature. A hot and dry day can lead to hyperthermia, whereas a cold, wet day can lead to hypothermia. Other causes to consider may be heat exhaustion, fever, or stroke. Other factors such as immobility, compromised cardiovascular and neurologic systems, drug toxicities, and comorbid conditions can cause poor perfusion and diminished compensatory mechanisms. Touch provides essential assessment information during periods of high demand. Once you have completed the initial impression phase, you have a general differential diagnosis. The next step in the process allows you to continue to refine your findings and act in a corresponding manner. This process includes the following: history of present illness, OPQRST, sample, vital signs, head-to-toe examination, and diagnostic results. The OPQRST mnemonic is a rapid way to cover the most pertinent pieces of the patient's interview. The process includes 1. Onset of symptoms, 2. Palliative or provocative conditions, 3. Quality of the pain or discomfort, 4. The region involved or the radiation of pain or discomfort, 5. The severity, and 6. The time and duration of the event. This tool helps you analyze the patient's complaint by focusing on obtaining a clear, chronological account of the symptoms the patient is experiencing. Detailed and accurate vital signs are normally the first step in the secondary survey. They traditionally include assessment of 1. Pulse, 2. Respiratory rate, 3. Blood pressure, 4. Body temperature, 5. Oxygen saturation. Even if the patient's initial presentation was not life-threatening, it may deteriorate over time. A good baseline will assist you in continuing to provide care needed for the condition. Up to this point you have been working with generalizations. Is the pulse rapid or slow? Is the breathing shallow, regular or deep? Is the patient conscious or unconscious? Adding to the accurate vital signs, investigate the details of the condition, including a full body examination and diagnostic information. The past medical history gives you an opportunity to learn about any pertinent or chronic underlying medical conditions the patient may have. Following the sample system will help you cover the most important pieces of the patient's history. The assessment includes signs and symptoms that the patient is experiencing. Allergies covers food, medication, or environmental causes. Medications will help you identify underlying chronic medical conditions the patient may have. The pertinent past medical history will allow you to focus in and determine if it is a cause or complication of the current episode. The last time well or oral intake will help in time-sensitive situations such as stroke, events leading up to the illness or injury. Together they should provide you with a clear picture of your patient's current state of health. The use of certain diagnostic tools and monitoring devices can help you clarify your differential diagnosis. These devices and tests are designed to assist the provider with diagnostic assessment. While these devices can supplement your processes, they are not a replacement for a good history and secondary survey. Each body system presents a set of unique assessment options to rule in or rule out your differential diagnoses. Use your clinical reasoning skills and analytical bias when making your differential diagnosis. Avoid tunnel vision and confirmation bias. Poor decision-making can be detrimental to the patient. A focused physical assessment is performed on patients who have sustained non-significant mechanisms of injury and on responsive patients. This type of examination is based on the cardinal presentation and concentrates on the immediate problem. The trauma patient will need a rapid head-to-toe examination to identify other injuries that may not be apparent to you following the trauma assessment process. Whichever examination you are using, always be thorough and complete in your documentation. In review, remember to 1. Incorporate the components of the rapid patient assessment pathway. 2. Utilize the sick, not sick system of rapid patient assessment. 3. Complete your initial observations of the patient. 4. Use your first impression to decide on a focused or detailed assessment. 5. Practice rapid and systematic differential diagnosis. And 6. Categorize patients initially to critical, emergent, or non-emergent conditions, according to body systems. Congratulations! You have completed the course and redefined your differential diagnoses. Ongoing management of the patient will require modification or termination of the treatment plan and move your patient to a final disposition. May your experience serving the pilgrims be fulfilling and rewarding.